Greetings from Kyoto, Japan. It's the night of the 20th of February, 2020. The big news today in coronavirus in Japan is that the National Institute for Infectious Diseases of Japan released a report on the coronavirus with a bunch of data about all of the people who tested positive for coronavirus. So what I've done is I've made a bunch of charts and graphs to explain the numbers that are in the NIID report from the Japanese government. I'm going to go over those in just a second. The government, I think, is saying that the quarantine was effective, and even though for a long time when we were looking at the news, it appeared that the number of cases was just going up and up. It looked like the infection was spreading all over the ship. However, when we look at the data in the report and we see how the numbers actually break down, it turns out that that's what we saw from the outside is not what was actually happening on the ship, and I think the quarantine probably was effective. But let's look at the graphs and data just to see why. Why is that the case? Okay, so first of all, let's look at the timeline of events here. We have the beginning of the whole thing started on the 3rd of February when the Diamond Princess arrived in the port of Yokohama. At that time, the Japanese authorities did not allow anyone to leave the boat, and then I guess it was in the port for a few days while they were deciding what to do, and they decided on the 5th to start quarantine. So they started the ship quarantine on the 5th of February. Now, there had been previous case reports of an incubation period for the COVID-19 disease of 2 days to 11 days. So they took a precautionary 2-week period, that's in pink. So the quarantine period was supposed to last for 2 weeks or 14 days. So they overshot that 11-day incubation period. So of course the theory here is if you start quarantine on the 5th, then there should be, in theory, there should be no new cases from this period. So, but because of the incubation period, people could still present with symptoms at any time in here. Anyhow, so they have this two-week quarantine period, and they expect that all of the cases will present by the end of the quarantine period. And at first, they were only testing people who were symptomatic. So if people had, they gave everyone pieces of paper and thermometers and asked them to write down their temperatures, take their temperatures. So anybody who had a temperature or who had other symptoms, I guess, of like coughing, would inform the medical authorities, and then the medical authorities would test them for the COVID virus. However, on the 14th, they started systematic testing. So from the 14th till the end of the incubation of the quarantine period, they tested everyone. So I think what they did, I don't think they tested everyone immediately. I think they did them in batches. So that's why you can see, if you were watching the news, what it looked like was from the 14th, we started seeing more and more cases reported in the news, and it looked like the virus was spreading. However, the new cases were a result of the fact that instead of just testing symptomatic people, they were testing everyone starting from the 14th. So we saw batches of new cases coming out, but that didn't represent new symptoms. It represented just new testing on a systematic basis. Okay, now let's look at the way the numbers break down. So there's a total of 3,711 passengers. People on the ship. Of those, 2,666 were passengers, 1,045 crew. The Japanese government tested 542 positive test results. Actually, I shouldn't say they tested, but they got, of the people that they tested, 542 were positive for COVID-19. They then broke those down into two groups. There were 184 of these positive test results that were people who had symptoms. So those are people that were tested before February 14th, in the period when they were only testing people who had symptoms. Then after February 14th, so they have this other group, 255 people who tested positive, although they never showed symptoms of having the disease. Okay, so why does the government think that most of the infections happened beforehand? So, of this 184 people who are symptomatic, 33, they had symptoms before the quarantine started. Okay, so if you're asking whether the quarantine was effective, these 33 people don't count because they were sick before the quarantine. So then from February 6th we have people who would have gotten sick after the quarantine period started. And so that's from those 184 symptomatic, there's 151. And then down here you can see from February 14th they started the systematic testing, and this is the 255, which they found from systematic testing, although these people did not complain of any symptoms or illness before they were tested. So we're going to look at a graph about these people that explains why the Japanese government thinks that the quarantine was effective. But in addition to the graph, we also have part of what's contributing to their confidence in the quarantine is that there's from February 13th until the 19th, there were some people, right? There were some people who were tested after being symptomatic, but 81% of those people were in the same room with someone who had already tested positive. So people on the ship were quarantined, but if they were staying, if they had a room on the ship with someone else, then they were not separated. They were staying in the same room. So it looks like from this late period of the quarantine, the vast majority of the new symptoms were coming from people who were sharing a room with somebody who had the disease. So that means that the quarantine was probably working because people were only getting sick if they were exposed to other sick people. These were not new illnesses that were coming from people in other rooms that were only connected by the air conditioning system or something like that. Okay, so before we look at the graph, so the last thing, there's 184, 255. This leaves 103 people, or 103 positive tests, where there was no confirmation of their symptoms. So these are people who are symptomatic, but they don't know when the symptoms started. So that is a question mark in the whole thing. And that's quite a large number, so it would really throw the whole quarantine into question, except that, as we're about to see, the graph of that shows these people and when they had the infection, or when they had the onset of symptoms, this graph suggests that the infection started before the quarantine period. So let's look at that graph. Okay, here's the actual page from the National Institute of Infectious Disease website. This graph with the blue and orange bars is a graph of the number of new patients with symptoms from 6th of February to 15th of February. I'm going to redraw this graph on a piece of paper so I can explain better why the government thinks that the quarantine worked. Okay, here I've redrawn the graph from the NIID website. You can see this line here is equivalent to the blue bars on the website, and this line here is equivalent to the orange bars on the website. So as I said previously, from other research, I think from China, so there was an estimate of about 2 to 11 days for the COVID-19 incubation period. So that's an average of about 6 days or an average of about a week. So if you see a graph of the onset of symptoms amongst a group of people, in theory, you should have about a week on either side of the peak of the onset of symptoms. So here we have the peak of onset of symptoms in the passenger population. You can see this part of this February 6th is the beginning of quarantine. So after this period we have hard data, but if you extrapolate this backwards, right? So here's the data, and then we extrapolate the curve backwards. You can see that it ends around the 1st of February. And then on the other hand, we have, starting on February 6th, the graph of the crew. They peak here, and then after this point we don't have any more data on the graph, but if you extrapolate, it's petering out. So what it looks like is, so quarantine started on the 6th. The ship arrived in Yokohama port around the 3rd, right? And so what it looks like is that there were 2 outbreaks of infection on the ship. One outbreak of infection was amongst the passengers, and it started at the end of January or the beginning of February, and then it really picked up speed and peaked just after the ship quarantined. The other outbreak of infection was amongst the crew, and it probably, so if it looks like this graph should probably extend a little bit back, so maybe the outbreak amongst the crew started around the time that the ship arrived in Yokohama port. So of course the crew, the reason there would be 2 different outbreaks, the crew and the passengers live separately. The passengers are all mingling with each other. The crew, of course the crew has some interaction with the passengers, but basically they live on other decks and they mingle with each other. So you have 2 separate groups of people, 2 separate outbreaks. Of course, then there's the 255 asymptomatic people. We can't really place them anywhere on here, but I think it's fair to assume that they probably fit into one of these 2 patterns. Anyway, that's what the Japanese government seems to be assuming. They're assuming that, so you can see, because the new cases are petering out, that the quarantine was effective at preventing a continuation of outbreak on the ship. So I tend to agree. I think that the people have been too hard on the Japanese government, and I think that this graph and the overall data tend to support the idea that their quarantine plan was effective. Okay, so we've taken a look at the data. We've seen that it appears that the virus was not spreading during the quarantine period, even though in the news, everyone who was watching the news, it just looked like the numbers were exploding and the virus was spreading all over the ship, but it wasn't like that. So why did this happen? Why did we see one thing in the news even though there was another thing that was actually going on behind the scenes? So I think this is just kind of an issue of Japanese culture. I think in a country like the US, the CDC would have been out there informing people of exactly what was going on the ship, so that everybody, there was no panic or anything. Japanese style is very different. I think that the way that the government handled this is just typical of the way things work in Japan. There was a lot of silence, although actually everything seems to have been carried out appropriately and effectively, even though we were not informed. It was like it was a need-to-know basis only. And I think if you live in Japan as a foreigner, you experience frustration about this, but that's just the way Japan is. So anyway, it's good to know that the quarantine seems to have been basically effective. Hopefully the virus won't spread anymore in Japan, and if you're in another country, hopefully it won't spread anymore in your country either. Have a good day. Thank you.